some reason I always thought, oh, value-based healthcare, that means like we're injecting some novelty into the system, and that's dangerous, right? Like in some way you can think of it that way, right? But what you're talking about actually is we're not suggesting, or you're not suggesting that we should implement some sort of device or drug that's not clinically effective. You're just saying this thing is clinically effective. Right now, we don't use it because the costs are too high using this model, but
Yeah,
we should expand, change the model because actually all these other costs are actually should be included as well, right? Like
exactly.
offset the actual initial cost, right?
Exactly. And thank you for highlighting that, because I think people are like, oh, not another kind of, radically different, trendy kind of way of doing things. No, it's actually it's a paradigm shift in the sense that it's a mindset shift. We're changing what we prioritize and what we value. And that should be not thinking of, how much does it cost, but what are we getting for the investment? And that the ultimate goal of a healthcare system should be health and not health services. So that means we need to measure it. So really, we're not asking people to radically change the way that they work. We're asking them to measure it and to actually do that continuous improvement based on real world data. But there's a second element, which is, so like I said, too often people think that they're measuring proms and poof, they're doing value based healthcare. You really need to tie the health outcomes to the costs, and then you can include other metrics too, like quality metrics like delays and things like that, and clinical outcomes, of course. But what's also missing is just doing that in itself, again, is not going far enough. You also need to better integrate care, data, and funding. So the integration, if you don't have data, you can't do it. So that's, you start by integrating data. That means the data has to follow the patient, whether they're at
Mhm.
the hospital, the clinic, the pharmacy. The data has to follow the patient. The second thing is integrate care. The healthcare professionals today are not working in an integrated fashion. There's a model in value based healthcare called the integrated practice unit. So today, what we have is, we call them interdisciplinary teams, multidisciplinary teams, but are they a team, or are they individuals intervening sequentially along the trajectory of care? Everyone's looking at a piece of the elephant and nobody sees the whole elephant. Some think that the leg is a tree, some think that the trunk is a rope, some people think that the body is a wall. Okay, but nobody sees the whole patient, right? So, a real integrated practice unit, a real team that is integrated, will see all of the elephant all of the time and make decisions based on not just the surgical outcomes for a surgeon, but the mental health outcomes, the pain outcomes, the mobility outcomes, the return to work outcomes, and everyone is mutually accountable for all of the health outcomes of the patient, because the ultimate goal is more than the binary, you live or you die, you have cancer or you don't. It's much more than that. And we all care about more than just yes or no cancer. You know, if I live, but I have a terrible quality of life and I'm suffering, is that a win for the system? It shouldn't be, right? And so that's why the integration of care is important. And then the third element is that integration of funding and payment. And so Quebec is heading in that direction, whether patient-based financing or FAP, financement accès sur le patient. So they're looking at a small scale now, which is better than doing it all at once. Because if you do it all at once, everyone gets discouraged and nothing happens. So they're doing little bundles and they're understanding, okay, radiotherapy costs this much, surgery costs this much, transplants cost this much. How can we pay for more than just the surgery? How can we actually pay for that little episode of care from, okay, we're going to do the surgery, how long does that take? Let's say like 30 days before, 30 days after. This is how much you get paid to attain these health outcomes for all the professionals and all the drugs and all the everything you need to include. Here's 200K, let's say. Okay, do what you will within that, and then it incentivizes innovation, it incentivizes improving outcomes. You tie the reimbursement to outcomes, of course giving a little bit of latitude for the appropriate amount of risk. Um, so but that value-based payment system, we're working towards it, and that's going to actually incentivize prioritizing value over cost. So those three things, having the data follow the patient, having the care follow the patient, and having the money follow the patient instead of an activity based model that we have, that will actually provide value for our health systems. And that's where we're headed. Some provinces faster than others. Definitely from the patient advocacy view, nobody's going fast enough, but that we're here to push them and to hold them accountable. But I really do believe that it's going to be good for patients and families first, but also good for all stakeholders if we manage to do this, because then we'll get the healthcare system that we deserve, by really prioritizing health above volume of services, for example.